Hi everyone, I'm Dana J, and this is Henry Ford Health System News, where we showcase our team members' accomplishments and our values of compassion, innovation, respect, and results. This time, let's start with a headline from our sports medicine team. According to their new study, high school athletes aren't sitting on the sidelines long enough after a concussion. Recently published research by Henry Ford suggests that on average, young athletes should wait 30 days before getting back in the game after their first concussion. Right now, Michigan High School Athletic Association rules say players showing signs of a concussion are benched for just 24 hours. Players on teams staffed by a Henry Ford athletic trainer are out for at least 5 days.
We're going to slowly bring you back, and I explain why we're going to slowly bring you back. We don't want to just throw you out there where you're going to get hit again, and then we're dealing with second impact syndrome.
The new research isn't likely to change rules right away, but study co-author Dr. Bill Mitsouris says the hope is it will start to change minds.
When you recognize that it can be up to 30 days to get a young student athlete back, you're going to change your mindset on how you advance them, in terms of how you push them, in terms of how you test them.
The study examined the records of 357 high school athletes treated for concussions at Henry Ford from 2013 to 2016. The findings also suggest female athletes, players with prior concussions, and those with delayed diagnosis may take more than 30 days to recover. Mitsouris says research also revealed that student athletes' brains don't heal as quickly as experts previously thought.
We thought that concussion issues would be very short-lived, that they wouldn't have as many attention issues, that they'd be able to recover to their sport much quicker, and we found the opposite.
Before the study, it was believed that a brain injury was like most others. The younger the athlete, the shorter the recovery time.
So we need more studies on the younger athlete. Many of us have children. We're all worried about them. We all want them to be safe. So we need to recognize that this is a problem for the youth athlete.
While research finds that concussions are still most likely in football, hockey, and soccer, that doesn't mean they aren't a concern across the board. In fact, our trainer tells us that every year for 4 years, she treated at least one swimmer with a concussion. An update for you now on our COVID-19 employee relief efforts. Hundreds of you have pitched in to help teammates who are struggling financially during the pandemic, to the tune of $892,000. The COVID Employee Financial Assistance Funds have supported more than 830 employees. A certified medical assistant at Henry Ford Allegiance Hospital tells us while she was furloughed, her mom experienced 2 brain aneurysms. The fund is helping her get by as she extends her unpaid leave to care for her mom. On top of that, $45,000 worth of grocery and gas gift cards have been given out to employees. Speaking of stepping up for one another, one of our teammates is kicking her hobby into high gear as we continue to battle the pandemic in our hospitals and our community. Liz Thompson spends a lot of her time in her studio.
I have beading supplies in here, I have sewing supplies, my computer lives here, I watch my old movies in here. Generally, this is my woman's cave.
When it became her home office during the spring surge in COVID cases, she looked around and knew exactly how she could use those supplies to help the residents she works with as a program coordinator at Henry Ford Hospital.
You know, you're sitting and you're going, all these people I know at work are getting exposed to this. What can I do to help? And it was like, I have fabric, I can sew. And I started making surgical caps for different people in the hospital, not just the physicians.
The surgical caps put a layer between frontline workers and the airborne virus and protect hair from being ripped out by the straps on N95 surgical masks. Thompson has sewed piles of them since March, sending them to the hospital with a friend. She saw someone wearing one for the first time in a photo from Henry Ford's 9 Minutes of Silence for Black Lives Matter.
I saw one of the cardiology fellows, and I'm like, that's my cap in that picture. And it just felt really good to know that, yes, they're being used.
When word got out how she was helping frontline workers, donations rolled in. She uses the money to buy enough, often very cheerful fabric to start sewing masks, too. And now that she's back to the office, she hands them out herself.
They know they can't use them when they're with patients. But if they're going to the grocery store, then you need to wear a mask. And you might as well have a nicer mask on, a friendlier mask.
Those brightly colored caps and masks really allow personalities to show through. And now our featured photo. Actually, we have two. That's Dr. Jasper Young, an emergency medicine physician at Henry Ford West Bloomfield, and Dr. Evan Lang, a radiation oncology resident at Henry Ford Hospital. They play together in the Detroit Medical Orchestra and appear in this video performing the Bach Double Violin Concerto alongside Grammy-nominated violinist Joshua Bell. Bell produced the video as a tribute to healthcare workers and recruited an orchestra of 10 medical musicians from the US and Canada. Thanks for spending some time with us today, and if you have a story idea or a featured photo to share, email it to me at newstips@hfhs.org. And I'll see you around.